Hello and welcome to today's Indeed webinar on evidence-based crime prevention, the European Crime Prevention Network's role in an emerging field. My name is Kai Brand Jacobson. I'm a colleague in the Indeed project and host of the Indeed Knowledge series, and I'm very glad to be joined today by Stijn Aerts. Stijn joined the EUCPN Secretariat in 2018 as a senior research officer. Since 2021, he's also the coordinator of the Secretariat. His main job is to create bridges between research, academia, and the front line, translating EU-wide knowledge and expertise on evidence-based crime prevention into actionable and easy-to-digest advice. Before his engagement at EUCPN, Stijn spent a decade as an academic researcher in various positions, where he aimed to find the right balance between fundamental and applied research. Proficient in Arabic, his research interests include Islamic radicalism, extremist Islamism, and jihadist recruiters' narrative discourse. He served as an advisor to the Belgian government regarding the prevention of radicalization. Stijn, before we dive in, and I also introduce the Indeed series, I'd like to take a moment also to welcome and to thank our partners in today's event, the European Crime Prevention Network. For those of you who don't know, the European Crime Prevention Network is a platform for knowledge exchange on crime prevention, which extends across 27 EU member states. The EUCPN is a member state-driven and co-funded by the European Union. In recent years, it has become one of the main actors in promoting evidence-based crime prevention in the EU and supporting frontline workers in the adoption of the principles of evidence-based prevention through the development of ready-to-implement tools, consultancy, and capacity building. And in this webinar today, Stijn will reflect on the state of evidence-based crime prevention in the EU, including how it compares and translates to other domains, such as substance use prevention. Results from an EU-wide survey among crime prevention practitioners commissioned by the EUCPN will be cited. Insufficiently developed prevention infrastructures are the main reason that the crime prevention field is lagging behind. This is illustrated by means of examples of exceptions to the rule. Finally, Stijn will introduce the main tools and services developed by the EUCPN to promote and support evidence-based prevention, paying attention to lessons learned, successes, and failures. These include, among others, a registry of effective interventions and several trainings for practitioners and decision makers. But before we dive into today's webinar, we'd also like to welcome everyone, including our speaker today, Stijn Aerts, on behalf of the Indeed Consortium. Indeed is a project supported by the European Commission, bringing together 19 partners from 15 countries across the EU, focused on the development of evidence-based evaluation in the preventing and countering of violent extremism and de-radicalization fields. The Indeed project has also created the Indeed Toolkit to be a one-stop resource space, consolidating a practical set of results developed within the Indeed project. On the toolkit, you can find the evidence-based evaluation model developed through the project, a hands-on evidence-based evaluation tool, which is available for your use to provide practical guidance through all stages of developing an evidence-based evaluation, e-guides on evidence-based evaluation and designing initiatives with evidence, and forthcoming on the website shortly, policy recommendations, the training support package, and online self-paced e-learning courses. The toolkit also hosts currently a repository of studies on risk and protective factors, which brings together a database of more than 250 studies that are being updated every single month. The final version of this database will be available soon. And we're now in the process of creating a second repository on evidence-based initiatives. You'll also find the e-guidebooks and other materials of the project available in 10 languages and easy for download. And throughout all aspects of the Indeed project, we're paying special attention to what we call GELSA, the gender, ethical, legal, and societal aspects of evidence-based evaluation and prevention work, including in the crime prevention and the preventing of violent extremism and de-radicalization. At the end of this webinar, we'll also invite you to complete a JELSA survey to let us know how well you feel we've engaged with these issues throughout this webinar, as we do in each of the Indeed events. And just to share with you one last bit of information before we dive into today's topic, today's webinar is part of a comprehensive Indeed Knowledge series, which includes both a series of webinars that have taken place throughout the project and will be continuing in the coming months, as well as video interviews with leading practitioners, experts, and scholars in the field, podcasts, learning notes, and more. At the end of today's webinar, we'll also include a short presentation of some of the exciting upcoming events, including the policy workshop in Riga on June 12th, and the Indeed final event and Policymakers and Practitioners Forum happening in Warsaw, Poland from September 11th to 13th. But now, let's dive into today's webinar, and I'm very glad to be able to welcome Stijn Aerts. Stijn, thank you so much for joining us. Stijn is going to take us through a three-part presentation, beginning with focusing on the state of evidence-based crime prevention in the EU and presenting results from the EU-wide survey that has been commissioned by EUCPN, before turning to looking at supporting evidence-based prevention and sharing with us some of the tools and services developed by EUCPN. And then at the end, looking at lessons learned, successes, and failures. While Stijn is presenting, we're also going to invite everyone who's joining us today, please do actively use the chat function on the Zoom platform. If you have questions, reflections, things you'd like to share, we'll be collecting those throughout the presentation and then having a dedicated session at the end after Stijn has finished, where we'll be taking up the questions that have been brought forward throughout the presentation. For now, just one more time to say, Stijn, thank you so much for joining us. We're looking forward to today's event, and I shall hand over the screen and the microphone to you.
Thank you, Kai, for the introduction and for having me in this Indeed webinar. I'll try to share my screen. Okay, I believe you should all be able to see my presentation now. If not, please give a sign. Okay, yeah. As Kai already told you, I'll divide this webinar in three parts. I'll first tell you a bit about the evidence, the state of evidence-based crime prevention in the EU, according to the EUCPN. In the second part, I'll make some shameless promotion for the products that EUCPN is currently developing to support the crime prevention field in the EU in the adoption and uptake of evidence-based prevention practices. And in the third part is where I'll dive into some lessons learned, some successes and failures that we've experienced in the past few years while trying to do that. Kai already told you all, but just as you know, by means of introduction, the EUCPN is a network which was established in 2001 that spans 27 EU member states at present and connects local crime prevention practitioners, national crime prevention policymakers, a host of EU partners, including agencies and networks, and finally, the research world as well. In the remainder of this presentation, I'll try to make sure that when I talk about EUCPN, I refer mostly to the Central Bureau or the Secretariat of the network. And when I intend to refer to the national policymakers and local practitioners as well in all of the 27 member states, I'll simply refer to the crime prevention field. The main goal of the network is to act as a platform for knowledge exchange, what used to be called good practice or best practice. But in recent years, we've tried to organize a shift to focus not just on what people in the field think is good practice or best practice, but really focus on evidence-based crime prevention. Now, because we have been in touch for 23 years now with the field, both nationally and at the local level. We think at the EUCPN, we have a very good overview of what is happening in the field. The trends that have been happening over the course of the past 20 years, but also the needs and challenges that local practitioners especially face when it comes to adopting evidence-based prevention. What's also important to know is that for close to 10 years now, we've maintained a database of crime prevention projects and programs, which is publicly available on our website. It's called the Knowledge Center, or the EUCPN Knowledge Center, and which is essentially a database of crime prevention projects that in the very recent past or currently are being implemented in all of the 27 EU member states. Now, I'll tell you more about the Knowledge Center in a bit, but what's important to know at this point is that unfortunately, still at present, it is just a collection of crime prevention initiatives as, or containing the information that's been sent to us at the EUCPN Secretariat. So at this point still, it is an overview of what national crime prevention policymakers essentially think is worth sharing with their peers in other member states. So it's a very, it represents a very subjective view of what good practice or best practice is. When talking about evidence-based crime prevention, and I suppose this will not be new, but the way we look at it, evidence-based crime prevention is or consists of three main aspects. The first is, of course, the crime prevention interventions themselves. And then the idea that we try to promote is that those interventions should be evaluated. Specifically, the outcomes of these interventions should be evaluated in order to establish whether they have or have not the intended effects. But on the other hand, in the design phase of the interventions, we should also look at the evidence that's already out there and develop and even select the interventions based on that evidence. Are they likely, or are they going to be likely to be effective or not? And of course, there is a very important link also between the evaluations and the evidence base, in the sense that when you evaluate the outcome of an intervention, this information is useful and contributes to and eventually makes up the evidence base, which in turn will hopefully inspire new interventions. Now, there's nothing new about this idea, and it was definitely not invented in the crime prevention field. But by now it has been common practice in the crime prevention field as well to at least pay lip service to the ideal of evidence-based prevention. Unfortunately, what we've noticed from being in the field and from having the network that we have is that by and large, the crime prevention field in reality focuses just on the interventions, and the evidence base and the evaluation parts are all too often, frankly, forgotten or disregarded. And when talking to people in the field, that's both decision makers at higher policy levels and the local practitioners, the frontline workers, is this is the idea that we had at the EUCPN, is that interventions were being implemented because the implementers were convinced or thought that they would be working without reference really to existing evidence. What we also hear a lot is that they're being implemented, those interventions, because that's what they've done historically speaking. So they're doing essentially what they've always been doing without questioning whether or not it works. When confronted with evidence that the interventions that shows that the interventions which are being implemented are unlikely to work, an argument that we often hear is that it works in our context. So or in our country, for instance, so the idea that context is important is often in the field being misused or misinterpreted in order to support, a belief in the effectiveness of interventions for which the evidence shows otherwise. Yet another reason that we hear is that evidence-based crime prevention, according to some in the field at least, would block innovation. There's a feeling among practitioners, sometimes, not all of them, but there's a very persistent feeling among a significant minority of practitioners that if you have to base interventions or select interventions from or design them based on existing evidence, they would not be able to innovate in the field, as if innovative crime prevention interventions by definition cannot be evidence-based. And finally, unfortunately, what we also hear a lot is that interventions are being implemented simply because the implementers feel that they are expected to implement those interventions. So they're not in a position, according to themselves, to even question that. Now, what we've done in order to check whether or not this idea that we came to have about the state of the field a few years ago was correct, we commissioned a research that would gauge both the attitudes and practices with respect to evaluation and evidence-based intervention design in the crime prevention field. And it was Teresa Silva, who, if I'm not mistaken, is now also a member of the advisory board of the Indeed project, and her colleague Mia Lund from Mid-Sweden University, who did this research for EUCPN, the fieldwork for which was done in the period 2019, and the first 2 months of 2020. And this research used a quantitative-qualitative mixed methods approach, including data collection from both surveys or through both surveys and interviews with practitioners and decision makers in the crime prevention field in all 27 member states. So the researchers went to a great length in having all the questionnaires translated and so on, in order to be able to penetrate to the local level practitioners as well. And of course, we helped them out as the EUCPN, because we did have the network in order to make this happen. And, I am not going to give you a lot of statistics or numbers. You can find the full research report on our website. And if you can't, I'm happy to send it to you. But I'll sum up the most important findings first with respect to what people in the crime prevention field are actually doing when designing and evaluating or supposedly evaluating crime prevention initiatives. And then secondly, with respect to how they feel or what their attitude is about evidence-based crime prevention and evaluation of crime prevention activities. So with respect to what they're actually doing, a huge problem that the research unearthed is that evaluability in the first place is very often compromised. So when we asked them how interventions, crime prevention interventions were designed, whether they'd done a proper problem analysis, what they had done in order to perform this problem analysis, it turned out that in many cases, the majority of cases, there's no such thing as a problem analysis, or at least not one that would qualify as a problem analysis according to the researchers. And when they performed one, it was generally speaking of poor quality. Another problem that we saw is that existing interventions, so manualized interventions, for instance, were borrowed essentially and then implemented with considerable changes. which of course opens the door to a number of implementation failures. And so, whereas we see that there is evidence regarding certain very effective crime prevention interventions, and they know about this evidence because they use it to actually implement or take inspiration from these interventions, they still underuse a lot of the time the information that's available on these validated interventions and change it or make changes, often for pragmatic or practical reasons, to such an extent that the fact that they're based on existing evaluations and existing evidence is no guarantee for positive outcomes of the implementations that they're doing. The researchers also noticed that more than 50% of all the people surveyed in this research reported that the interventions they implemented were not grounded. So this is, in their own estimation, were not grounded on theoretical or empirical knowledge. And more than 40% reported that the crime prevention mechanisms underlying the interventions that they're actually implementing had not been identified beforehand. So that's, around half of the people in the field reporting that they really didn't think about how the interventions they're implementing would contribute to a risk, to a reduction in the risk of crime occurring, which, in my view, boils down to the fact that the logic models were very often illogical or not logical at all. A result that we actually at the EUCPN found a bit surprising is that 44% of the cases of this is 44% of the interventions, according to our respondents in the research, were formally evaluated, or the outcomes of them were formally evaluated. This was significantly higher than we at the EUCPN Secretariat would think. But unfortunately, less than 20% of those 44% used a controlled test or anything better than that. So very often, they're simple pre-test, post-test evaluations without a control group. And one final piece of information that is worth mentioning that came out of this research is that conditional funding seems to be the factor that more than any other determines whether or not the outcomes of crime prevention interventions are being evaluated. Conditional funding here means that, for instance, local practitioners, could be an NGO, could be a government actor, receives funding, usually from the national level, to implement the crime prevention initiative on the condition that they would also evaluate it. So essentially, they do it if they have to and get the funding for it, and otherwise they don't. Now, with respect to the attitudes that the prevention workforce has towards evidence-based crime prevention and the evaluation of crime prevention activities, this is much more positive. And again, perhaps a bit to our surprise at the Secretariat. I mentioned before that, we were shocked sometimes when we heard people say that they implemented interventions just because that's what they had always done and stuff like that. But overall, I mean, those minorities exist, but overall, the great majority of the people in the crime prevention workforce are very positive towards evaluation. They strongly believe that it is useful to determine whether an intervention works. They'd also like to use evaluations to determine, to improve the interventions that they're implementing and to motivate, their colleagues and their workforce in turn. They also point out, however, that evaluation is often deprioritized when resources like time and money are limited. So it's very low on the agenda. And this is, according to them, one reason why it's, why so little effort is being done to actually perform evaluation studies. They also report that, according to them, negative attitudes towards evaluation, even though they, are a minority position, may be the result of the fact that the results of previous evaluations have been disregarded. So when a crime prevention intervention is being evaluated, it is important that action is being taken that's, inspired by and along the lines of the results of these evaluation studies. And this in turn will also motivate the workforce, especially frontline workers, to adhere to the ideal of evidence-based crime prevention. And finally, when asked what in their subjective view keeps the prevention field, that's essentially a question about themselves, but also their colleagues. What prevents the prevention field from engaging more in evidence-based crime prevention and evaluations is, first of all, that they feel a lack of involvement of all the stakeholders. So many practitioners feel that, let's say they did want to do an evaluation study, they would not be able to secure the cooperation of all the partners of which they need the cooperation. They fear they would not secure access to the data that they would need in order to perform the evaluation. Time and resources, again, are reportedly often lacking. But very importantly, a vast majority also report that they wouldn't know how to do it or how to go about it. So they indicate that they lack the expertise to actually perform an evaluation. So while we were surprised by some of these findings, and some of these were a bit misaligned with the subjective idea that we had come to adopt at the EUCPN Secretariat, the fact remains that there's a lot that we just do in crime prevention, and for which we really have no basis in evidence. There's a bit, there are interventions in crime prevention as well, which we know are effective, and we do implement in the EU as well, a bit of them, but there's also a number of very effective crime prevention interventions which are not being implemented because people in Europe don't know about them, because they seem too difficult, too cumbersome, they require a lot of resources and investment up front, and so on. What's perhaps even worse is that there's also a number of things that are being done continuously in the crime prevention field, of which we know they are not effective, and in fact, they might even have iatrogenic effects. Now, what the study didn't really do is try to provide explanations for why this is the case in Europe, probably elsewhere as well. And again, this is our subjective view at the EUCPN, but we think we can draw some conclusions just from the fact that we maintain perhaps the biggest crime prevention network in the EU. The first is, again, as respondents also indicated, we strongly believe that the lack of formal training plays an important role. The reason the whole idea of evidence-based policy originated in the field of medicine and then public health is because people who are trained in medicine or public health in their curriculum are trained in evidence-based policy and practice as well, evidence-based medicine, evidence-based public health, and so on. There is no training for crime preventers as such. And if there is one, evidence-based crime prevention probably does not play a huge role in it. We think, however, also that a part of it can also be traced back to the fact that crime prevention is a very fragmented policy, and as a result of that, accountability is also very fragmented. And this is, actually the same thing. The workforce is very diverse as well. So what do I mean by that? No one probably in the entire EU would identify themselves as a crime preventer or as a crime prevention officer or something like that. People either work as educators, as social workers, they're with law enforcement, they have a job in the welfare system, mental health care system, you name it. And all of these contribute to crime prevention. We also notice in the network where the original idea of the network was that it is the national institute or organization, government agency responsible for crime prevention that would be represented in the EUCPN. We've noticed in 2001 that this doesn't work because crime prevention as a policy responsibility is often, distributed across ministries of interior, ministries of justice, law enforcement agencies, often plural, depending on the country, and so on. And then, of course, at the local level again, municipalities, and so on. And, we believe at EUCPN that this translates also into, the fact that no one takes the lead in, promoting evidence-based crime prevention or evaluating prevention policies and so on. Another reason might be that prevention itself, or the effectiveness or the need for prevention itself, is often called into question. When dealing with partners who you have to convince that the prevention itself is a worthwhile response to a crime problem, then you're not going to be talking a lot about the effectiveness of that prevention. Well, you should, but it doesn't happen. So a lot of effort, we think, is being wasted essentially on convincing others that prevention itself is a worthwhile response to crime problems, rather than about the effectiveness of particular crime prevention interventions. And then there's one thing which we have recently come to realize that plays a huge role, is the role of language. A lot of the evidence, especially good evidence, is available in English and nothing but English. Of course, this is also mainly due to the fact that academics publish in English because that's what's most interesting for their careers. But practitioners at the local level in nearly all EU countries do not command English to such an extent. They don't at all, or they do not to such an extent that they can deal with academic publications and so on. So I think that at least in part, this explains why all English-speaking countries are a bit further along the path towards evidence-based crime prevention is simply because access to the evidence is easier and more straightforward for them as it is for most practitioners in the EU. Now, there's one thing which I wanted to mention. There is right now, as we speak, actually, a renewed interest in crime prevention, and especially evidence-based crime prevention. And this is perhaps a bit counterintuitively due to the perceived rise in organized crime in the EU, which comes at a very high cost. The problem with organized crime is that, the costs, all the costs associated with crime are higher for organized crime than they are for most other volume crimes. There's a cost of anticipating the crimes and crime-proofing infrastructures. The consequences of crime, so the harms caused by organized crime, are usually bigger or more extensive than those caused by volume crimes. The criminal justice responses, so investigating organized crime, arresting offenders and punishing them, or higher than they are for volume crimes. And finally, there's a societal effects in the sense that organized crime, unlike volume crimes, comes with the risk that it might erode trust in democracies, disrupt legal markets, and so on. And so what we see now happening in the EU is that organized crime is very high on the agenda, but at the same time, there's this realization that the more attention we devote to organized crime, the higher the cost will be, because a large part of that cost is related to the criminal justice response to organized crime. At the same time, there's also the realization that organized crime, unlike volume crimes, is very much resilient to criminal justice responses. Arresting even kingpin figures in organized crime networks rarely makes a mark even. Someone else takes their place and the criminal organization or operations continue to go on. The same when we interrupt a few tons of cocaine, it's collateral damage essentially for those organized crime networks, and they just continue going about their business. And so what we see now is that for instance, but we see it everywhere, in the EU roadmap for the fight against organized crime, one out of the 4 key priorities is the prevention of organized crime. I don't think in the past 20 years, crime prevention has ever been so high on the political agenda. And I think this opens up some, possibilities for the advancement of evidence-based crime prevention in the EU as well. So, what have we done at EUCPN to address this problem, to address the fact that the field is lagging behind other fields, in, particularly, of course, evidence-based medicine and public health, but even substance use prevention, for instance, they're further along than crime prevention is. We have tried, to garner some support for the idea, for at least the idea that crime prevention should be evidence-based. And so what we've done is have all 27 EU member states, after a lot of negotiation, accept a single definition, EU definition of crime prevention. And this definition, so this is the EUCPN definition of crime prevention, is that crime prevention are ethically acceptable and evidence-based activities aimed at reducing the risk of crime occurring and its harmful consequences, but the ultimate goal of working towards the improvement of the quality of life and safety of individuals, groups, and communities. So we've just simply put it in there that the activities should be based on the best available evidence, and that the result should be that they reduce the risk of crime occurring, which is a very clear reference to the outcomes which crime prevention activities should have in order for them to be labeled effective or a good practice or a best practice, or whichever word you'd like to use for good crime prevention. Now, of course, this is a very symbolic thing, a definition. I mean, it doesn't have the power of a law or something like that, and it's nothing but a definition. Which is why we went a bit further, and based on the recommendations also from the research that Silva and Lund did for us, we first of all convened a task force on evidence-based crime prevention with a number of experts in it. They helped the network draft what I will refer to as an evidence-based strategy, which was adopted unanimously by the network in 2019, at the end of 2019. Sorry, 2021. what we've done in this crime prevention strategy is questioned the very, the way the EUCPN had been working up until then, which was for 20 years. And, we very critically asked ourselves, is it still okay in 2021 to be promoting crime prevention interventions as good practice or best practice when we're not absolutely sure that they are effective, when they're not necessarily evaluated, and so on. And so the central question which this task force, together with the network, has been working on for the better part of a year was, what is worth sharing? What is worth promoting as a good practice in the crime prevention field? And very quickly, we realized that, given the state of the field, given the way things were going in the crime prevention field, we would not, or it would not be desirable to apply the same rigid standards as they do, for instance, in evidence-based medicine, where we'd say anything that's not been, evaluated through a randomized control trial or something like that, we will readily dismiss it. That's not something we could do. What we did do, however, is come up with 4 minimum criteria. And from then on, essentially, any crime prevention project or program that we would promote as a good or best practice would have to meet at least these 4 criteria. So the first is that there should be a very clear description of the crime problem. So this, again, refers to the lack of proper problem analyses that we see or saw so often in the field. Project descriptions and problem analyses should clearly define which specific crime problems and activities are being addressed. Of course, this also will then tell you what the indicators for success or failure will be in the end. And so there should be sufficient information and a sufficient effort to gather this information about the nature, the scale, the context of a crime problem. Secondly, there should be a clear description of the way in which the intervention addresses the identified problem and why it is expected to be effective. So there should be information, for instance, about the targeting of the intervention. Is it universal, selective, indicated? The beneficiaries or the clients, if you wish. There should be information, or at least, a statement by the implementers on why the intervention is expected to work. So with reference to underlying mechanisms, ideally, of course, also with reference to existing evidence, a logic model, theories of change, and so on. And there should be indications of any contextual factors that may have been or may be necessary for success, or which, the implementers believe will influence the success. Third, there should be robust and positive outcome evaluation, or at least strong indications of theoretical plausibility. So on this third minimum requirement, we had a lot of discussion. Of course, ideally, there should be an outcome evaluation, and it better be a good one as well. We just figured at that point that the field, again, referring back to everything that we learned about it through researches and through our experience as well, is that the field would not be ready to evaluate, every single crime prevention initiative that they implement. And so it would also do if there are strong indications of theoretical plausibility. So if implementers could point out, this is the evidence that we based our intervention on, we think it will work because we have, the same contextual factors are at play, and so on and so on, then that would also qualify as good practice. And the fourth one has to do with information validity. So we strongly believe that, you can have the best crime prevention project, but if there's no information available for others as to how to learn from this, or how to implement it for themselves, then there's no point in sharing it. So there should be sufficient information about the nature of the intervention, the original context, the factors that influenced effectiveness, and the implementation of activities so that others could implement it the same way. So this also, of course, refers to information that, to a process analysis, process evaluation, sorry, and the information, the information provided by that process evaluation and the quality of the process evaluation as well. Now, around these four minimum criteria, we are at present, so all of this is taking some time, designing a portfolio or a suite of products and services for implementers, for practitioners or frontline workers. First, in order to help them to base their own interventions on the best available evidence, we've developed an assessment tool called QualiPrev in order to check fairly quickly and objectively to which extent crime prevention initiatives meet these four criteria. We will then also use that, or we will use that primarily, I should say, to decide whether or not we should include a crime prevention intervention as a good practice or best practice in our own knowledge center or our own registry of crime prevention interventions. On the other hand, we'd also like to support or provide support to frontline workers when they'd like to evaluate their own interventions and thereby expand the evidence base or contribute to the evidence base. So we are already providing training on, for instance, the evaluation of crime prevention activities to people working in the field. And we are developing a series of online tools that workers might use to support or in support of the evidence-based intervention design and evaluation of crime prevention initiatives as well. In addition to those online tools, we are also already, but we'd wish to do so more in the future, offering offline support to prevention designers in helping them in concrete cases, helping them out, providing consultancy with respect to evidence-based intervention design and evaluation. So let me tell you a bit more about a few of these products. So QualiPrev is, as I said, a design quality assessment tool for crime prevention projects and programs. It is not an evaluation or an outcome evaluation itself. It looks at the information that we have on a crime prevention intervention, including any information that might be provided by process or outcome evaluations. It's a tool that was essentially developed for our own use. We would use it for an annual European Crime Prevention Award that we organize in December, but more importantly for our own knowledge center. It is outsourced, however, so everyone can use it. But it doesn't look pretty, I guess is what I want to say. It's just an Excel sheet with a number of questions, but it has been developed together with researchers from Ghent University. What we aimed for is that all of the questions are simple yes/no questions. What you're looking at on the screen is actually two of the few examples where there's, where you can answer, where there's an in-between option between yes or no. So these are the more difficult questions. But by keeping it as simple as possible and aiming for mostly yes/no questions, we also try to make it as objective as it can be. And then the sheet or the Excel sheet, automatically keeps score essentially. In the end, what you get is a percentage indicating the extent to which the intervention meets first of all, each of the 4 criteria. So they're referred to as, EBA stands for evidence-based approach 1, 2, 3, 4. There's an aggregated final score. So in order to end up in our database, all of those should be 50% or above. And then if an outcome evaluation has been performed, the result of that, so whether it's effective, inconclusive, ineffective, and so on, is also being indicated. So the example that you see on the screen would indicate that this is, with 67%, is actually a very well designed intervention. Quality of the an outcome evaluation had not been performed, but effectiveness is likely because of the quality of the theoretical basis and the theory of change. Now, a manual for QualiPrev is on its way, so we actually have it, but it's not been published yet. Again, this was also designed with researchers, with our advisory board, and should provide very clear guidelines to QualiPrev users so that they would interpret questions and answers in the same way. We've tested this actually, so we validated QualiPrev as well when we have several people use it and apply it to the same intervention based on the same information that we have on the interventions. The results are very, very similar. So it seems to work out in that respect. And I will give a webinar on QualiPrev and how to use it if you'd like to use it for yourself on the 4th of July in the morning, I think at 10 a.m. Now, so the primary use for us at EUCPN for QualiPrev is for our database of quote-unquote best practices. This is something that we've been working very hard on, and is going to go live in a few weeks. So it's not at present. So this means that at this point in time, it's still the old collection of crime prevention interventions, which at least one person in the EU has identified as a good practice that's worth sharing with others. What we'd like to do in the future is, based on the information that we get from QualiPrev, is to be able to tell to tell exactly what's good about something, what maybe is not so good and could be done better. Again, we refer back to those 4 minimum requirements, and through a 1 to 5 star score for each of these requirements, you'll be able, as a user of the registry or user of the database, you'll be able to see in the blink of an eye how good the design of crime prevention interventions are, and we'll be able to tell you a bit about the strengths and weaknesses and so on. And then this will also result in a label that will add to those interventions that have both a high QualiPrev score, so information and validity is good, outcome evaluation is good in terms of quality, and that have been proven to be effective. Regarding the trainings that we have developed, there's currently 2 that we're rolling out. There will be more in the future, most likely, but we're still figuring out what our priorities are in that respect. But we have an evaluation, we have a training on evaluating crime prevention initiatives, and we have a second one on key concepts in crime prevention. Both address different issues and are also targeted at different audiences. The training on evaluating crime prevention activities focuses on basic knowledge and skills related to evaluation studies. They really aim at frontline practitioners. And this is one of the things that I'll get to again when I discuss the lessons learned, but this is taking time and resources. We've developed it again, with input from academics. We've validated it, so we've tried it out in different samples of the target group and improved it. But now the time has come to turn this into a train the trainer thing, where we try and identify qualified national trainers who could provide this training in national languages to their prevention workforce. And so this is challenging and resource intensive also for us at the Secretariat, but I think it is absolutely necessary that we do it this way. We've been doing it quite successfully in English for very small subsections of the target audience, namely those that are proficient enough in English to have the training in English. And so we know it works and it's interesting and relevant for the target group, but we just can't reach them with English, or we can't sufficiently so. So we have a manual for trainers as well. It's essentially a 1.5-day training. And what's important to know also is that we've designed it from the very beginning in such a way that it is not intended to give people very technical knowledge or skills in advanced evaluation methods of methodologies and so on. So we can't make someone an evaluation expert in 1.5 days. If you don't have statistical skills necessary to perform certain types of outcome evaluations coming into the training, you won't have them going out of the training either. The main idea is that people come in the training or leave the training and they know better than before what people are talking about when they're saying things like a pre-test, post-test, a randomized controlled trial. So they can now, when they've done the training, they can appreciate the value of this kind of terminology. They know what's generally better than others, with which methodologies are generally seen as better than others. They can participate in discussions around these things, which is very important. And many of them coming into the training had the feeling that they couldn't before doing the training. And so what we do continuously in the training is also tell people, this is something that you're very unlikely to do yourself, but you could outsource it. And we also explain how you can go about that. And also because of the information that they gain in the training, they are now better placed to actually go to a researcher, either an academic one or someone from a private firm. They know what to ask, they know what to look out for, and so on. Now, the training is made up of 8 modules, which discuss what, according to us, are the 6 essential steps of a crime prevention evaluation study. The first step, it's basically about the theoretical foundation, basic crime prevention theories. Perhaps the most important part of the training is the second module regarding the framework for evaluation and the preparation of an evaluation, which we argue strongly in the training should happen in the design phase of the intervention itself. And again, this goes back to what we learned from our experience in the field in the EU, is that problem analyses are very often just skipped. Objectives are not articulated, program theories are lacking. And so what we do in the training is put a lot of emphasis on the 4 things we think should be a part of the design phase of an intervention, which is problem analysis, articulation of objectives, program theory, and logic model. And which essentially, if you have done that, you have the evaluation framework as well. We discussed 3 types of evaluation: plan evaluation, process evaluation, and outcome evaluation. The reason we included the plan evaluation, which is essentially an evaluation of the program theory and the logic model, before implementation has even started, is because it plays an important role in the crime prevention field, in the sense that more and more EU member states are looking into conditional funding schemes, where essentially, as very usually a local authority or a municipality applies for national funding through a national subsidy scheme, and they'd have to indicate this is what we're going to do. And then someone at the national level is evaluating a project on paper that has not been implemented yet. So this is essentially what a plan evaluation is. And then, of course, we cover also the very practical stuff related to evaluations of crime prevention initiatives, because we know that a lot of people in the field are struggling with this. How do you plan for it? How do you budget for an evaluation? So this is all part of the training as well, up to and including communicating the results, which is so important, of course, because if you do not make them public and do not communicate about them, you're not contributing to the evidence base either. The second training that we have is on key concepts in crime prevention, and it's really for a different, it's actually geared more towards people who are not active in the crime prevention field, so people who we at EUCPN would not consider to be part of the crime prevention workforce. But it's more about telling them why crime prevention is important, how it can contribute to an effective criminal response to crime problems in general. And so this is a very short training that's very much shorter than the other one. It takes just a few hours, and where we explain basic crime prevention theories, but also crime prevention successes and some myths surrounding crime prevention, including that it doesn't work, for instance. And the training itself is also then again connected to some of the online tools and templates that we already, to a limited extent, provide. More to come over the course of this summer. And of course, if people leave the training, try to implement aspects of it in their own professional setting, they can also always come to us. It is part of our mission to provide advice and consultancy to people in the field. One more thing that we do in that respect is creating links and connections between practitioners from different member states. So very often what we see is that people are struggling with certain aspects related to evidence-based crime prevention or evaluating crime prevention initiatives. But because we have this overview at the Secretariat of the EUCPN, we can relate it to other professionals who've had very similar experiences and who maybe have found solutions, so we can bring people in touch with each other and create these communities of practice, if you will, where people across borders can exchange ideas and experiences. Now, what we've learned, and this of course also relates to some of the successes and failures that we've seen, not just over the course of the past few years, when starting to very actively promote evidence-based crime prevention, but also in the 20 years before, where essentially we hadn't gotten any further than creating a database of best practices, which was not backed up by the proof that you should expect to be behind such a database. First of all, is in the EU context, we do not have the advantage that, for instance, the United States has, which is linguistic unity. Localization and translation are of key importance. The prevention field is not to be mistaken with, experts such as ourselves, who are all proficient in English and who are working in international environments and so on. This is not the case for the people who are doing the work, or not necessarily the case for the people who are doing the work in the field. So this is something that has been challenging for us. We've known for a long time, but funding is needed and so on, to make all the translations and to get people with proficiencies in different languages on board and so on. But if you're not able to do it, then you might as well forget about it. Secondly, very importantly, money talks. When trying to convince people of the necessity of both crime prevention and the evaluation of crime prevention initiatives, there's a significant subsection of the target audience that is more, how shall I put it, sensitive to any arguments related to cost benefit and cost effectiveness than when you leave out the cost aspect. So crime prevention has the potential, when done right, and there's evidence that backs this claim up, to be vastly more cost effective and cost beneficial than other criminal justice responses to crime problems. But you have to tell people that. Similarly, when telling people that evaluations are necessary and that evidence-based prevention is the way to go, the idea, I imagine, that pops up first in their mind is, well, there's something else to throw money into or towards. Evaluations do cost money. But if you can show them, and this can be done, that by evaluating, by working evidence-based, you will, in the mid and long term, end up with interventions that are more cost-effective and more cost-beneficial, then all of a sudden, they open up to the idea of evidence-based prevention. And I think at EUCPN, it has taken us quite a while to realize just how important this is to convince people who are not on board yet. And this is the single argument that works best, I think, to convince this group. And since we've learned that, since we've realized that and really adapted our strategy, our advocacy strategy to that realization, I think we've gained more traction, both as a network, but also for the idea of evidence-based prevention. Another important lesson is that you have to target both or different levels of management and the frontline workers. We've experimented with, trickle-down strategies where we'd address middle and upper management, for instance, in a police organization, in hopes that the message that we had would trickle down to the frontline workers. And of course, it didn't. And we've experimented also with the opposite, where we go directly to frontline workers, hoping to change their minds, and then, expecting to see some benefits in the field in the middle or the longer term. And both of them haven't really worked out in the past. What we now do is offer or bring the same message, but in different ways to different, so tailored to different target audiences, and tackle all levels of management and the frontline workers at the same time. Again, of course, this is also why translation is so important, because especially the frontline workers, you will not be able to reach most of the time in English. So the idea is that there's really no such thing as free energy, and you can't expect messages or practices to either trickle down or move up in hierarchical organizations. And this, we are working a lot with law enforcement in there especially. This simply doesn't work. So you really have to talk to everyone. And the same is true for different professions. So like I said, we have a very diverse workforce for crime prevention. And, the example that I always use is you have policemen, you have social workers. There's many more, of course, but they, there's different organizational cultures that these, two archetypes of prevention workers represent. They have different sensitivities. They have access to different kinds of information and data. They've had different trainings. And so you have to address each of that. Now, how to do that is a bit difficult. We are constantly at the EUCPN shifting between very tailored messages, trainings tailored towards police, trainings tailored towards social workers and educators, for instance, recommendation papers specifically for police, recommendations specifically for social workers, and so on, which they like. We've tested it, we've asked them also. People do not like to spend a lot of time reading. They mostly don't get the time to read on their jobs, at least. So they are happy if you can just tell them what to do in their position, and you can leave out all the stuff that's intended for someone else, essentially. However, at the same time, we've also find it very valuable to gather different or representatives from different professional groups around the table. So again, when I apply this to the training, we've had very good experiences where we have people from different professional backgrounds participating in the same training session. And in the training, we have all kinds of practices, exercises where the participants in the training are supposed to apply the things that they've learned to a fictional or a fictitious crime problem, and then develop an intervention and evaluate it. And so what's very interesting is that they can learn, or that they experience in the training what the sensitivities are of the other actors, of the other stakeholders. Social workers, they can learn from police and about police, and the other way around when they participate in the same training. So there's something to say, really. There's a lot of value in offering tailored advice, tailored services, tailored products for different professional groups at the same time, bringing them together around or in a single event around the table is also very valuable at times. I think, well, perhaps one final note on the last point is that one type of actors that should not be forgotten is the academic world or researchers. They as well have things to learn from the people doing crime prevention in the field. I think the research world has a giant responsibility as well to present research results and outcomes in such a way that they are relevant and useful for implementers and practitioners as well. And this is something that we feel is often forgotten or overlooked by them as well. So bringing them on board, addressing them with messages regarding evidence-based prevention is important as well. I'll end my talk here, but I do have time for any questions. I think I've seen there are a few.
Stijn, I would like to say thank you very much. Thank you for what has been a superb and very richly informative presentation. Much appreciated. You're correct. We have had a number of questions that have been raised. Some of them have been sent to me directly. Some have been shared in the open chat room altogether. We'll try and get to all of them now. The first one is with regards to, you highlighted some of the challenges that often exist in implementing evidence-based initiatives, evidence-based practice. You spoke about the absence of program logic or theories of change, logical frameworks, often very weak or not having been completed problem analysis. And the question was with regards to Do police and actors at local and national levels have the tools in their local and national systems provided to them for doing these steps? Is there that standard of practice, both the existence of the tools and the expectations that that is part of how good crime prevention work is done? Stijn, I think you're on mute now, just so you know. You can keep it open throughout the conversation.
I think from experience, in most member states, the answer would be no. So they don't have the tools. There's no guidelines for standardized practice. And in some, I'd say that, you know, this is what we would refer to as a prevention infrastructure, and it would largely be absent in most member states. And this is a problem not just for police, but you know, in other professional groups as well. I know this is some sort of caricature, but you know, the police, at least they have a culture of working with data. They keep track of, you know, number of investigations, number of cases solved, number of arrests, and so on. The number of those arrests that lead to a conviction. In my experience, and this is maybe counterintuitive, this makes it easier for us when talking to law enforcement than it does, for instance, with social workers who may have a tendency to just think that what they're doing is right. So they don't even have this culture of collecting data, keeping track of successes, if you'd call it that. So, but no, standardized practices are really an exception to the rule. There's some great examples of, you know, in Sweden, a large part of the funding provided by the National Crime Prevention Council for local initiatives is conditional on a preparedness to perform an evaluation. They'd also have to indicate when applying for funding what they'd look at, which variables they will track, and so on in the evaluation. So at least this creates a very clear incentive. Similar, you know, ideas are happening now in Belgium, but you know, decisions still have to be taken. I know in Estonia, they have quite well-developed prevention infrastructure that is rooted essentially in public health and substance use prevention, but is now also starting more and more to encompass the crime prevention field, which I think is a good thing, because there's a lot that we can learn from those fields as well. But generally speaking, I'd have to say no. In many places, prevention is something that we do, or that is being done, because, you know, it has been decided historically that prevention is also important. You know, obviously, policymakers or decision makers don't really believe that, because the resources that are being put towards prevention are marginal compared to other responses to crime. But still, they put some resources towards crime prevention, and someone has to use those resources. This is essentially what's being done, and no one's tracking what exactly is happening with these budgets and so on.
And you mentioned in your presentation, and it's come up in other contexts as well, that when it comes to the amount of money that's being made available and lots of programming taking place, there is the reality that quite often a lot of money is spent on programs that don't have significant results. We're doing what we're doing because it's what we've always done, or it's because of what politicians and policymakers have indicated should be done, but not building upon evidence base and not tested and evaluated. You spoke also in terms of evaluation about a challenge that has come up in a number of webinars and interviews we've done, and also in smart hubs across Europe engaging with practitioners. This aspect that in what you might call an early generation and still the standardized practice, but not one we would call a good practice of evaluation, the major form of delivering the results of the evaluation is often through an overly complex and extended text, often intended for academic publication, often written for academics, very much not taking into consideration professional use or the needs of users, be they policymakers or practitioners. However, at the same time, we've spoken about at EUCPN developing tools from your targeted, briefings or guidance to sector-specific or different stakeholders, the tools you've been developing on the website, the trainings you're developing. Do we need to think perhaps a bit more robustly at how we package and format findings from evaluation so that they can actually be fit for purpose, fit for use, and fit for needs in the field? You mentioned that practitioners often don't have time to read extensive reports. Policymakers will generally not read extensive reports. There's also the aspect of the style, the way in which they're written, the languaging in which they're written, which make them very non-relevant for proper professional use. Is there a need in the field to begin thinking of who do we want to use it? How do you get information into their hands? What tools can be useful for them in a way that you can actually increase that connection between results and findings in evaluation and actual impact to inform evidence-based policy and evidence-based practice?
Yeah, I fully agree. And this is essentially what we're trying to achieve now at EUCPN, mainly when I think about the QualiPref and then the way it's going to be used in our database or best or knowledge center. We've thought long and hard with different task forces and representatives of different member states and different professional groups, ranging from academics to frontline practitioners who are working at local level, on both the design, the graphic design of the database and the information that's going to be in it and the way it's going to be packaged and so on. And what we've noticed is that very often there's a discrepancy between what researchers, especially academics, think we should offer as information for practitioners and what practitioners themselves would like to see and the way they would like to see it. And so obviously they're both right, but what we've done is, there's been a lot of back and forth between those groups, and we've put them around the table together and trying to come up with something that would work for both. But mostly the practitioners, they're our primary target group. So we were ready to accept that there might be certain types of information that might be relevant and useful for them, but maybe they don't realize it yet. After all, what we've seen is that they are mostly not accustomed to evidence-based policy and evidence-based practice. So there might be information out there which they would need in order to do that, but they don't realize it yet.
Fingertips, and they don't see it.
Yeah, but in the end, we'd like it to be a product or products, plural, that is targeting specifically frontline workers and the people in the field. So, and this is also why it's going to look very different from an academic journal or an academic database, and also very different from similar initiatives that we've seen in other fields. EMCDDA has been maintaining the exchange database of effective substance use prevention programs for a number of years now, which is a very good initiative and which has become very influential in that field. And so we've looked at it and we've dissected how it came about and how it works, and then also found out in discussions with our target audience, our target groups, that we could not, that made it very clear that we could not just copy that to the crime prevention field. They're at different stages of development in the adoption, as far as the adoption of evidence-based policy and practice is concerned. And so we've tried to, our aim is to design a product that's fit for the crime prevention field as it is now in Europe.
You've mentioned a number of times in your presentation now as well the growing development and engagement with evidence-based practice as a field, citing its early origins, of course, in the medical field, but seeing it more and more in different areas, which is something we've seen in the Indeed project as well. And one part of that, of course, and this links to some of the questions we've received, is with regards to evaluation. Evaluation being a tool, one of the tools for identifying what is evidence. However, we've also seen a number of challenges in that area. Eleanor Chilimsky, who was one of the giants of developing the evaluation field in the 80s and 90s, and the first head of the US Government Accountability Office's department or unit for evaluation, once pointed out that when they were trying to provide evidence to policymakers to inform policymaking, and they did what were the first synthesis evaluations. They would collect every existing evaluation, look at what did they indicate. A challenge that they faced was that the vast and overwhelming majority of the evaluations themselves, the quality was so poorly done that you could not refer to what was identified or what was found there as evidence. This can often be because evaluators in the field are not necessarily very well trained. Unfortunately, still a lot of evaluators often come from academic or consultancy backgrounds where they may actually not have background or experience in evaluation per se, may not have topical knowledge of the field, and often are exposed to or familiar with one type of evaluation and not necessarily up to date on more advanced and innovative approaches. We've also heard from law enforcement agencies that simply having an expert or someone called an expert coming from the outside, dissect, interrogate, investigate them, and then come with their findings doesn't necessarily produce a learning process and a robust engagement with and discovery of what is actual evidence that can help to guide and inform their practice. I was wondering, in your work, you referred to 40+% being evaluated, 22% that was more robust. Did you have any insights on the actual quality of approaches to evaluation in the crime prevention field today, and any thoughts there on what needs to be improved?
Yeah, so in the research that we commissioned, the questions didn't reach much further than the research design or the methodology that was being used in the outcome evaluations. So we don't have a lot of very high resolution information on the quality of the evaluations that the respondents were talking about. Of course, we do know from experience that in Europe, just as in the US, the quality itself of evaluations is often questionable, to say the least. Obviously, we try to address this in the training, but maybe not so much by telling people, what potential problems might be in terms of the quality of evaluation studies and how to do it the right way, because it would become too technical much too quickly. And as you said, you better leave it to experts, in the field to do all of that. But what we do try to, or an idea that we do try to sell very actively, is that anything in terms of evaluation that you're not going to do internally or yourself, and which are going to outsource, get the evaluators on board before the implementation phase and in the design phase of the intervention. Very often, I think the poor quality of evaluations is often because there is a misalignment between the data that, or the information that implementers can give to evaluators who are only hired when everything's been done and implemented and the project is essentially finished. And then so there's a huge misalignment between the data that these evaluators are given and the research questions that they're supposed to answer. And this is very preventable by paying them slightly more and bringing them on board a bit earlier. This is essentially what it boils down to, but it's a mistake that we see all the time, really.
You've
Yeah,
spoken very clearly also about the importance of having clearly carried out good quality problem analysis,
yeah,
program logic and
yeah,
theory of change, outcome evaluation, and that building these into your design phase together with engaging evaluators early can help improve both the quality of the initiative design and the likelihood of achieving impact, but also the evaluability of it later on.
absolutely. So, another way that we see poor evaluations are being born, poor in terms of the quality of methodologically of the evaluations, is also because the interventions in the first place were designed so poorly that it would be next to impossible to subject them to a proper evaluation. So, I mean, if the stated objective of a crime prevention initiative that's being rolled out in one municipality is to contribute to a safer society in country X, which is what we really see in the field sometimes, then I mean, there's no way you can
That's a
evaluate
bit
something
broad.
like it.
Yeah.
Yes. So objectives are often not clearly articulated. They're too vague. They're too broad. They're too unrealistic. Whatever. I mean, they're simply not good, and it makes not for a evaluable intervention that way. So again, that's also why it's important, I think, to bring experts if you're going to bring them on board in the design phase. It'll make for a better intervention as well as a better evaluation.
Stijn, you have so much experience. The work of EUCPN is so pivotal in this field. I think we could keep discussing for hours, but I'm aware that we are at time, and I also want to very much appreciate the participation of everyone who has joined us both here and in the streaming of the webinar. We have two questions maybe I could just share with you briefly at the end, and then just to let everyone know, we will do a short presentation of the upcoming webinars tomorrow and in the coming weeks, together with training opportunities and further resources in the field, just very briefly at the end of Stijn's response here. Stijn, two other questions. One was with regards to how can people access these trainings? So if someone's interested, how can they benefit from and get access to these trainings by EUCPN? The second question was with regards to the role of business in the field. What is the role of business in evidence-based practice? For example, companies providing CCTV hardware or services was asked if you have any reflections on the role of business, either positive or negative, in influencing and impacting evidence-based practice or what's being done in the field.
Yeah. So regarding the first question, access to the training, just by the way the network is organized, this happens through your national representative. So if you go to our website, eucpn.org, go to the contacts page, select your member state, there will be a name of a national representative, which is your national representative in the EU. Send them an email or give them a call to inquire about this training. Apart from that, this is the official way. You're always welcome to email the Secretariat directly at the email address that's also on the bottom of our webpage. And then we'll see whether it'll happen or not. Essentially, it's the national representatives who are responsible for organizing training sessions in their member states. We're always happy to go there and give the training. With respect to the role of businesses and the private sector in crime prevention, this is a emerging or growing topic in recent years, I'd say. We've had very good experiences working actually with companies in the field of crime prevention. So we have a bit as sort of a side activity for EUCPN, but we do engage in some operational prevention activities at the EU level within the impact framework. One example I could give where we've had some successes is in the prevention of online fraud using online platforms, both tech support platforms such as AnyDesk and social media platforms such as Facebook and all the rest. What we've noticed is that they have commercial stakes in whatever it is they're doing, and they would not like to listen to anything we have to offer and just implement it right away. It helps if you have 27 member states behind you, because this is something that we do see where bilateral negotiations between these platforms and individual member states have failed in the past. They're now more successful when they're, when there's someone there speaking on behalf of 27 member states. On the other hand, what we've noticed is that, there's sometimes a discrepancy between what companies promise their products will do in terms of preventing crimes and what the actual evidence shows. So in those cases, it's important to, to act as a sort of independent party and provide citizens or people who might use those services or buy those products to try and inform them that they perhaps do not perform as promised. And then again, we've also had, we've had experience with talking to those companies as well and market their products differently. The example of CCTV is actually a good example where we know that it works very well sometimes and it doesn't in other cases. It does not, for instance, generally speaking, work to prevent domestic burglary if you put a camera on the, the front of your house, but it does work very well against shop theft and that sort of stuff. So you can also reorient those businesses a bit, not telling them to not sell those products, but helping them, giving them also the information on when it works, how it works, and where it doesn't work.
Stijn, thank you very much. On behalf of the Indeed project and the entire Indeed consortium, we'd like to express our appreciation and thanks again to Stijn and to EUCPN for the important work you're doing and for having been a partner and contributed in many different moments throughout the Indeed project. Just to share with everyone briefly, also thank you to everyone who has attended today's webinar. We mentioned evidence-based evaluation a number of times throughout the presentation, just to share with you the model that is brought forward from Indeed, inspired again by the practice in medicine. It looks at best existing knowledge and validated evidence in the field, but it also looks at these other components of community and stakeholder values, preferences, and circumstances, and brings out the need to really engage with in-depth understanding. Part of what, Stijn, you were also speaking about is problem analysis, also knowing the context, the community, the situation in which you're engaging, stakeholders you're engaging with, and highlighting the vital importance of engaging with professional judgment and expertise in the field as well. And professional judgment and expertise, just as with evaluators, just as with stakeholders, can often have biases and prejudices as well, but it also has a lot of experience that is built up that is valuable to engage with. So these three pillar components of evidence-based evaluation to inform evidence-based policy and practice. For those who are looking for actual tools online which can help you in thinking through how to approach evaluation, there is the Indeed evaluation tool, which has been designed, validated, and tested with practitioners, stakeholders in smart hubs across Europe, as well as expert evaluators, academics, and professionals in the field. And the Indeed tool focuses on 4 different moments when you may, in practice, be doing your evaluation. Module 1 is the one we emphasize the most, building evaluation right into the design and development phase of your initiative. For those who are developing initiatives in the crime prevention or preventing and countering radicalization and violent extremism fields, you're developing your project, your policy, the initiative you're going to do. Module 1 helps you to see how to build evaluation and right at that phase. It also, like all of the modules, includes guidance on engaging with gender, ethical issues, societal and legal aspects of evaluation, as well as quality standards to make sure that the evaluation you're doing actually increases or has a higher likelihood of being able to provide validated evidence. Module 2 is for already ongoing initiatives. If you are in the midst of doing work and you didn't plan or prepare to integrate evaluation at the beginning, but now you would like to see how to, that's Module 2. Module 3 focuses on outcome evaluation. If the work is completed and now you're looking at planning an evaluation, either as practitioner agencies, government authorities, or if you are an evaluator yourself. Module 4 brings forward a very interesting focus on case-based learning and case-based evaluation, something that we have seen to be of tremendous value and relevance within the field. Now, all of these are available online. They're available in 10 languages. This was something that Stijn emphasized throughout. We'd like to really support and repeat this as well. If we want to make tools and resources useful and relevant for practitioners in our communities on the ground, we need to make that available in local and national languages, not only having things available in English, but ensuring that we have the languages accessible in the context of those who are using them. These materials are available in 10 languages of the European Union. For some of the upcoming events, just to let you know, tomorrow we'll have a special Indeed webinar actually on JELSA, gender, ethics, and societal aspects, also looking at the legal aspects in PCVE evaluation. We'll have two of the Indeed experts, Norbert and Hannah, who will present on the tools they've developed, as well as Gazbia Sanz, a brilliant practitioner and evaluator herself, who will share from a hands-on practitioner perspective. Then later in July, continuing our effort to make visible great work being done in the field, such as that by EUCPN, our earlier webinar also on the new ICCT M&E Center of Excellence. On the 9th of July, we'll be joined by our colleagues from Preval in Germany, one of the first ever national initiatives set up in the European Union to bring together scholars, practitioners, law enforcement agencies, and others to look at improving evaluation and learning in the field. Here, our colleagues from Preval in Germany and a colleague joining from Australia will look at developing and implementing evaluation support tools. Across the EU at the moment, we're having a series of cascade trainings. News on these is available on the Indeed website, taking place in Romania, France, Germany, Finland, Belgium, the Netherlands, Spain, Portugal, Bulgaria, Latvia, and elsewhere. If you are interested in receiving training in the field, we'll be announcing these on Indeed social media platforms and by national partners in each country. We'll also be making 2 online courses available in 10 languages. They're self-paced courses. You can take them whenever you wish. It's also designed for use by professional agencies, law enforcement, governments, civil society, and community service organizations in the field. They're self-paced courses, so you take them at your own pace. One is on designing evidence-based evaluation. The other will be on designing evidence-based initiatives. So designing initiatives with evidence and going through all the stages that Stijn mentioned today. For those working in the policy field, we have the Indeed Policy Forum, the first taking place online now on June 27th and 28th at the end of this week. This will be followed by the in-person policy recommendations workshop in Riga on the 12th of July, recognizing the importance of engaging with policymakers to recognize how important evidence-based evaluation, evidence-based policy, and evidence-based practice are. Stijn mentioned some of the key arguments here, including the cost effectiveness of engaging with evidence-based practice. It helps us to avoid the wasteful use of funds on things that we already know or that are proven not to work. The other thing is that it's also time saving. If you continue doing policies, practices, and initiatives which don't achieve impact, actually the investment in understanding what works, what doesn't work, how and why helps us to do things in more time-effective ways. Then one of the highlights of the Indeed project overall will be the second international forum and the final Indeed event, From Evidence to Practice Towards Improved Policy and Practice, a 3-day event in Warsaw, Poland, bringing together policymakers, practitioners, experts, professionals from across the field, and we very warmly invite you to join us in Warsaw on the 11th, 12th, and 13th of September. Finally, we will share a note at the end of this webinar to everyone who has taken part. Thank you so much once again for joining us. We'll have an evaluation form for the webinar, and we'll also have a short Indeed JELSA survey where we'd like to invite you. We do this for all of our events in case you can give your feedback on how we've engaged with the issues of gender, ethics, legal, and societal aspects in this Indeed webinar. Again, all of the Indeed webinars, video interviews, and podcasts will be available through the coming weeks on the Indeed website in the toolkit section, and we'll also make the online courses, training support packages, and more materials there. Once again, thank you very much to everyone who has joined us today. And thank you in particular, Stijn, for this superb presentation on evidence-based crime prevention, the EUCPN's role in an emerging field. We wish you the very best in all you do going forward and hope to see you again for future Indeed events.